Okay, today we will be discussing the anatomy questions of subject-wise test, and in this we will be discussing the question number 61 to question number 80, and myself Dr. Shilpi Agarwal. We will start from the question number 61. The question number 61 is regarding this picture, which is the SEM of the embryo. In this we have to first of all identify these various structures which are present over here. Now this structure, this is the embryo, and in this A structure which has been shown over here, this is the primitive streak. The groove which is present over here, this is the groove, primitive groove which is present over here, and this whole structure is the primitive streak. The D structure which is shown over here, this is the primitive node or the primitive pit. The B structure which has been shown over here, this is the neural plate, and just below this neural plate the notochord is present. This is a neural plate, and below or deep to it we have the presence of the notochord. Then the C structure which has been shown over here, these are the neural folds of the neural plate. These are the folds of the neural plate. Now when we talk about the primitive streak is basically derived from the epiblast. From the epiblast cells, and this primitive streak, it leads to the formation of all the 3 germ layers. So it forms all 3 germ layers. That is, it helps in the process of gastrulation. This process is known as gastrulation, and apart from this, it also helps in the formation of notochord. So therefore the notochord is also derived from the epiblast cells. The notochord, when it is formed by the primitive streak, after that the notochord, it induces the formation of neural tube. It basically induces the overlying surface ectoderm to become specialized, and that overlying surface ectoderm, it becomes neural plate, which will later on lead to the formation of neural tube. So if you take a cut section over here, if this is the ectodermal layer, this is the endodermal layer, and in between we have the mesoderm. The location of the notochord over here, which is formed by the primitive streak. Now this notochord, it induces the overlying this ectoderm to form a specialized structure known as neural plate. And this neural plate will later on lead to the formation of the neural tube. The neural plate, later on, from the sides of the neural plate, the folds, they come from the sides of the neural plate, and they reach towards the midline, they will fuse, and they will lead to the formation of the neural tube. So later on, the folds, they arise like this. This hole is the neural plate, and now we use the term as neural folds, and this depression which is created is the neural groove. Then these neural folds, they approximate, and they will lead to the formation of the neural tube. When the neural tube formation is occurring, it leads to the formation of neural tube. The whole of the tube, it fuses except the anterior neuropore and the posterior neuropore. The anterior or the cranial neuropore of the neural tube, it closes by the 25th day of intrauterine life. and the posterior neuropore or the caudal neuropore is the one which is last to fuse, and it closes by the 28th day of the intrauterine life. So therefore it leads to the formation of the neural tube. Apart from this, a structure which has been mentioned in the option, the neuroenteric canal. This neuroenteric canal, it is present at the point of the primitive pit only, and this is the point where actually the amniotic cavity is communicating with the yolk sac. So a communication between amniotic cavity and yolk sac. Now this is a temporary communication and it is closed later on. So if you come back to the question it says that you have to identify the incorrect option. In this A, it gives rise to endoderm. Yes, we know that the primitive streak is giving rise to all the 3 germ layers. Then underneath B, that is this neural plate, the structure that stimulates neurulation is present, that is notochord. C, this option is not correct because C is the neural groove, the neural folds, and D is the site of opening of neuroenteric canal, which is opening at the primitive pit. So the answer for the 61 question is the C. Then question number 62, the fibers which pass through crus cerebri the question number 62, the answer for this is A. When we talk about the midbrain, if we take a transverse section of the midbrain, this is a transverse section of the midbrain, and in the center it is having the cerebral aqueduct. This is the cerebral aqueduct. The portion of the midbrain which is present dorsal to it, this portion which is present dorsal to it, this whole portion is the tectum, and this tectum portion, it includes the superior and the inferior colliculi. Then the portion which is ventral to this whole portion is the cerebral peduncle. Now this cerebral peduncle, it is again divided, it is having 3 components. It includes first, second and third. First is this one, and second is this one, and third is this one. The first structure is the tegmentum, second is the substantia nigra, and the third is the crus cerebri. Now when we talk about the crus cerebri over here, through the crus cerebri the fibers are passing. If we see towards the middle portion of the crus cerebri, over here the corticospinal and the corticonuclear fibers are running over here. The corticospinal and the corticonuclear fibers. These portions of the crus cerebri, towards these portions, the corticopontine fibers are the one which are running over here, which are coming from the different portions of the cerebrum. The corticopontine fibers. So therefore, if we see the question is asking about the fibers which pass through the crus cerebri, and the fibers which are passing through the crus cerebri, that includes the corticospinal and the corticonuclear fibers. They are passing through the crus cerebri. So the answer is A. The next question is question number 63. In this we have to identify the structure which may lead to or which may affect the respiration. The question number 63. First of all, we will identify the various structures which are present over here. The A structure which has been labeled over here, this is the phrenic nerve. This is the phrenic nerve. Then the B structure which has been labeled over here, this is the sympathetic trunk. The C structure, this is the vagus nerve. And the D structure which is present over here, this is the D structure, this is the recurrent laryngeal nerve. The recurrent laryngeal nerve. Now in this, if we see that the phrenic nerve is the one which is going to supply the diaphragm, it will be supplying the diaphragm. So therefore, if this nerve is affected, it will lead to, or it will affect the respiratory movements. So the answer for this question will be A, that is the phrenic nerve. Now if you see the phrenic nerve, it is passing anterior to a muscle. The muscle which is present over here, this muscle is scalenus anterior muscle. For the vagus nerve, it is actually passing within the carotid sheath. These are the structures which are enclosed by the carotid sheath. The carotid sheath is present over here and it encloses these structures and it is going till lower down area. Now when we talk about the carotid sheath, the structures which are included in the carotid sheath, it includes the common carotid artery along with the internal carotid artery. Then the vein which is included is the internal jugular vein, and along with that a nerve is there, that is the vagus nerve. These are the structures which are present within the carotid sheath. Towards the anterior wall of the carotid sheath we have ansa cervicalis, and towards the posterior medial side of this carotid sheath we have the sympathetic trunk. So the sympathetic trunk, it is present towards the posterior medial side. The posterior medial aspect of this carotid sheath. The recurrent laryngeal nerve, this recurrent laryngeal nerve, it is actually running in the tracheoesophageal groove. It runs in tracheoesophageal groove. So by knowing this, by knowing the location and the relations, we can identify these various nerves. Within the carotid sheath we have the vagus nerve. Then towards the posterior medial aspect of carotid sheath we have sympathetic trunk, and this is a ganglionated appearance is there like this. The recurrent laryngeal nerve, it runs in the tracheoesophageal groove, and the phrenic nerve, it is running anterior to the scalenus anterior muscle. This is the same picture so as to which is showing the various structures. This structure over here is a sympathetic trunk. Then the phrenic nerve which is going like this, and if you see this cut section of the neck, we can see the recurrent laryngeal nerve. The recurrent laryngeal, this is the position of the recurrent laryngeal nerve, and it is lying in the tracheoesophageal groove. This is the location of recurrent laryngeal, and this is the location of the vagus nerve. The vagus nerve is lying within the carotid sheath, and towards the posterior medial side over here lies the sympathetic trunk. The sympathetic trunk is present over here. So these are the various structures which are present over here. If we see the cut section, we can see the exact locations. Now the next question is question number 64. We have to match the wrong option which is in this. The answer for this question is D, that is 64 question. Now the various derivatives from the arch. The question number 64, the answer is D. Now when we talk about the derivatives of the arches, first of all the derivatives of first arch. The derivatives of first arch, these arches are basically made up of mesoderm, that is a mesenchyme, and which is coming from the paraxial and from the lateral plate mesoderm, as well as the neural crest cells. They also migrate over here. The mesenchyme, it helps mainly in the formation of the muscles, and the connective tissue structures, they are being formed by the neural crest cell. Now for the derivatives of first arch, the cartilage which is formed by the first arch is the Meckel's cartilage. Then the bones which are formed by this, the bones are malleus, incus, maxilla and mandible. Along with it, the spine of sphenoid. The ligaments which are formed, it includes the anterior ligament of malleus, and the sphenomandibular ligament. Then the muscles which are included in this, all the muscles of mastication are formed over here. The muscles of mastication, that is temporalis, masseter, and the both medial and lateral pterygoids, they are formed. Apart from this, mylohyoid and the anterior belly of digastric. Then the tensor tympani and the tensor velar palatini, they are also formed. So all these structures, these are being derived from the first arch, and the nerve for the first arch, the nerve for the first arch is the mandibular nerve. The artery for the first arch is the maxillary artery. So these are the structures which are derived from the first arch. All these structures are derived from first arch. Now the derivatives of the second arch. For the second arch, this cartilage is derived from the second arch. Now the bones which are formed, it includes the stapes, styloid process, then the hyoid bone. In the hyoid bone, it is specifically forming the lesser cornu and the superior portion of body of hyoid. The superior part of the body. So these bones are formed. And if we talk about the ligament, the ligaments which are formed are stylohyoid ligament, muscles which are formed, the stapedius muscle, then we have stylohyoid muscle, then there is posterior belly of digastric, and all the facial muscles. So all these structures, these are being derived from the second arch, the cartilage, ligaments, bones, and the muscles. And the nerve for the second arch is facial nerve, and the artery for the second arch is the stapedial artery. The stapedial artery and the hyoid artery. All these are the structures which are derived from the second arch. Now when we talk about the derivatives of third arch, for the third arch, the structures which are derived are, the bone which is derived is hyoid bone, and in the hyoid bone, now the rest of the portion of hyoid bone, that is the greater cornu and the inferior part of body. Apart from this, it is giving rise to one muscle, that is stylopharyngeus muscle. The stylopharyngeus muscle. The nerve of this arch is glossopharyngeal nerve, that is the 9th cranial nerve. And the artery for this arch is the right and the left common carotid and the internal carotid artery. So these are the derivatives of third arch, and when we talk about the fourth and sixth arch, in this the fifth arch it disappears. Fourth and sixth arch, they combine together to form the cartilages of larynx. The various cartilages of the larynx, and along with that the muscles of larynx and pharynx. For the fourth arch, the nerve for the fourth arch is superior laryngeal nerve. The superior laryngeal nerve and the artery for the fourth arch. On the left side it forms the arch of aorta, and towards the right side the artery is right subclavian artery. For the sixth arch, the nerve is recurrent laryngeal nerve and the artery for the sixth arch is pulmonary artery. Right and left pulmonary artery. And towards the left side over here also, the right some portion it leads to the formation of the ductus arteriosus. So all these are the derivatives of the various arches, and therefore we can say the answer for this question is D, because third arch is not giving rise to the lesser cornu, but the lesser cornu is being formed by the second arch, and third arch it gives rise to the greater cornu. Now the next question is regarding the upward gaze. Question number 65. For the question number 65, the answer is D. When we talk about the upward gaze or the vertical gaze, the nucleus which are responsible for seeing upwards or downwards, the main nucleus which is responsible for this is interstitial nucleus of Casal. Apart from this, also the rostral interstitial nucleus is there, which is a part of the medial longitudinal fasciculus. For the horizontal gaze, the main structure which is involved is PPRF, which is the paramedian pontine reticular formation. So therefore the answer for this question is D. For question number 66, in this we have to identify the incorrect statement. First of all, we will identify the various structures which are present over here. This is the question number 66, and we will first of all identify the structures. In the A, if you see the A option, this is one of the veins, and this vein is the superior ophthalmic vein. This is the superior ophthalmic vein. Then the B structure over here, it is a ganglion which is present over here, and this ganglion is the ciliary ganglion. This is the ciliary ganglion which is basically present between the optic nerve and the lateral rectus. And this is a ciliary ganglion which is carrying the various parasympathetic, sympathetic and the sensory fibers towards the muscles of the eyeball. Now the C structure which has been mentioned over here, the C structure is the nasociliary nerve. The nasociliary nerve, it is a branch of ophthalmic nerve. The D structure over here which is mentioned is superior oblique muscle. The superior oblique muscle, if you see, it is present on the medial side and it is running just above the medial rectus. As it goes towards the anterior aspect, over here there is a fibrous pulley where it takes a turn and then it reaches towards the eyeball, and it is inserted in the eyeball behind the equator. The muscles which are present over here which has been cut, these are levator palpebrae superioris, and just below that we have the superior rectus muscle. The muscle which is present over here, this is the lateral rectus muscle. Now the nerve which is present over here, this nerve is the lacrimal nerve which is supplying the lacrimal gland, and a cut nerve portion can be seen over here. This is the frontal nerve. The lacrimal nerve, frontal nerve and the nasociliary nerve, all these are the branches of the ophthalmic nerve. The frontal nerve, it will further divide into supratrochlear and the supraorbital. The nasociliary, the further divisions of nasociliary are, it divides into anterior and posterior ethmoidal nerves, as well as it divides into the infratrochlear nerve Then it gives long ciliary nerves, and apart from this it is giving ganglionic branches to the ciliary ganglion. Now in this, the ethmoidal nerves are the one which are responsible for supplying the dura mater of the anterior cranial fossa. So they supply the dura mater of the anterior cranial fossa. The ciliary ganglion, as we have just discussed, the ciliary ganglion, it is carrying the parasympathetic fibers, which will be supplying the ciliaris muscle and the sphincter pupillae muscle. It carries the parasympathetic fibers, and these parasympathetic fibers are basically coming from the Edinger-Westphal nucleus, which is present in the midbrain. From there the fibers are carried through the oculomotor nerve and then to nerve to inferior oblique. Then it enters in the ciliary ganglion, and from here these nerves, the short ciliary nerves, they reach towards the ciliaris muscle and the sphincter pupillae. It supplies the ciliaris and sphincter pupillae. Now another structure which has been mentioned over here, the superior oblique muscle, the action of the superior oblique muscle. The action of the superior oblique muscle is it helps in the depression of the eyeball as well as in torsion and abduction. These are the actions which are performed by the superior oblique muscle. The medial rectus, it helps in the adduction movement, and the lateral rectus, it helps in the abduction movement. The inferior oblique, if we talk about the inferior oblique, it helps in the elevation, extorsion and the abduction movement. For the superior rectus, the action performed by the superior rectus is it helps in the elevation as well as in torsion and adduction. For the inferior rectus, the movements are the depression and they help in extorsion and the adduction movement. So these are the movements which are performed by the various muscles which are present over here. Now if you come back to the question, the answer for this question number 66, the question number 66, the answer is D. Now if you come back to the question, we can identify it. The option A says A is a tributary of cavernous sinus. Yes, superior ophthalmic vein, it is one of the tributary of the cavernous sinus, and along with that inferior ophthalmic vein and the central vein of retina. These three veins are the tributaries of the cavernous sinus. Then B, that is a ciliary ganglion, it gives parasympathetic fibers to the sphincter pupillae muscle, it is also correct. C is the nasociliary nerve, it innervates the dura mater of anterior cranial fossa, it is via the ethmoidal nerves, so this is also correct. Now the question, the option D is not correct, so this is the answer. The injury to the nerve supplying D, that is the superior oblique, in this case the patient tilts the head, the tilting of the head of the patient is to the side opposite to the lesion. So if the lesion is towards the right side, the tilting of the head will be towards the left side. So this option is not correct, and the answer for this question number 66 is D. The next question is question number 67. It is regarding the iliolumbar ligament. Now this picture shows the iliolumbar ligament. This is the iliolumbar ligament, and in the picture if we see, the iliolumbar ligament, it begins from the transverse process of L5. This is the transverse process of L5, and it is going till the posterior portion of inner lip of the iliac crest. So this portion, whole of this portion, this is the iliolumbar ligament. It is a triangular ligament. First of all, it is a triangular ligament, and it begins, attachment is, on one end it is attached to the transverse process of L5 till the posterior part of inner lip of iliac crest. Now this whole of the iliolumbar ligament, it is having superficial fibers and the deep fibers. We can say upper fibers and lower fibers are there. The upper fibers, they are all going towards the iliac crest, and the lower fibers, if you see, they are towards the base of the sacrum. This iliolumbar ligament, due to its presence over here, it is basically maintaining the stability of this lumbosacral joint, as well as it also maintains the stability of the sacroiliac joint, which is present over here. It prevents the anterior movement of that joint. Apart from this iliolumbar ligament, it continues with the layers of the thoracolumbar fascia. And if you see the relations of this iliolumbar ligament, just anterior to the iliolumbar ligament, the muscle which is present is psoas major. Posteriorly, the erector spinae is there, and above we have a muscle that is the quadratus lumborum. The answer for this question is D. Now if you come back to this question, the question says which is not correct. The upper fibers, they are attached to iliac crest and the lower fibers are attached to the base of the sacrum. This is correct. They help in the maintenance of lumbosacral stability. This is also correct. And D option, which is not correct, is that upper attachment is to the transverse process of L5. So the answer for this question number 67 is D. For the question number 68, inferior thyroid artery. The inferior thyroid artery, it is a branch of the subclavian artery, and in the subclavian artery, it is specifically a branch of the thyrocervical trunk. So for question number 68, for the question number 68, the answer is C. If we talk about the subclavian artery, the subclavian artery, it is extending like this, and this subclavian artery, it is again divided by a muscle of a neck, and this muscle of the neck is the scalenus anterior muscle. The scalenus anterior muscle, it divides the subclavian into three portions. The one which is medial to it is the first, the portion which is deep to it is the second, and the distal portion is the third. Now the branches which are given from these respective portions of the subclavian artery are, from the first part, regarding the branches, the first part, it gives of the vertebral artery. The vertebral artery runs in the neck, it runs upwards towards the neck, and it is passing through the foramen transversarium of C1 to C6 vertebra, and then it further goes above and it enters through the foramen magnum and it reaches the cranial cavity where it unites to form the basilar artery. Another artery, internal thoracic artery. The internal thoracic artery, it goes towards the thoracic region, and over there the terminal branches of this artery are musculophrenic artery and the superior epigastric artery. Then it gives off a thyrocervical trunk. The thyrocervical trunk, this thyrocervical trunk in turn will divide into three branches. The three branches of thyrocervical trunk are, first is the inferior thyroid artery, then it also gives suprascapular artery and the transverse cervical artery. So therefore in this we can see the inferior thyroid artery, it is a branch of the thyrocervical trunk, which in turn is a branch of the subclavian artery. So these are the arteries which are arising from the first part. Now when we see the second part, from the second part arises the costocervical trunk, and from the third part arises the dorsal scapular artery. The costocervical trunk, it will again divide it into the branches, the deep cervical artery as well as superior intercostal artery. So these are the branches of the subclavian artery, and to be more specific, inferior thyroid artery is a branch of thyrocervical trunk which arises from the first part of the subclavian artery. The next question, the question number the question number 69, it is regarding the nerve supply of the adrenal gland. So for the question number 69, which is regarding the nerve supply of the adrenal gland, for this the answer is A. When we talk about the adrenal gland is being supplied by the whole of the adrenal cortex as well as the adrenal medulla. It is being supplied by the autonomic nerves and specifically by the sympathetic nerves, which are actually present around the various blood vessels, and in this way they are affecting the secretions which are coming out of the adrenal cortex and the medulla. So therefore, the nerve supply will be affecting the secretion of the catecholamines from the medulla as well as the secretion of the steroids from the adrenal cortex. So it is basically by the sympathetic fibers. So for this question number 69, the answer, we have to identify the true statement. The supply to the adrenal gland is by the preganglionic fibers from lower thoracic and lumbar vertebra via the sympathetic chain to supply adrenal. The rest of the options are not correct because adrenal medulla and cortex both are having the nerve supply, and the release of catecholamines as well as the steroids, they are affected by nerve supply to the adrenals. The next question is question number 70 about the C cells. The question number 70, when we talk about the C cells are being derived from the neural crest cell. The answer for this question is D. Over here, a structure which is mentioned is ultimobrachial body. The ultimobrachial body, it is a remnant of the fifth endodermal pouch. It is a remnant of the fifth endodermal pouch which is actually attached to the fourth pouch, and it is named as ultimobrachial body. And in this ultimobrachial body, the neural crest cells, they come over here, they reach here, and after reaching over here, they lead to the formation of the parafollicular C cells of the thyroid. So therefore, for the parafollicular C cells, the structure which gives rise to it is the neural crest cell. The answer for this question is D. The next question, the question number 71, which of the following structure is not injured in the submandibular gland excision? In this we should know the relations of the submandibular gland, what structures are present in relation to this gland. Now this picture is showing the relations of the submandibular gland. This is a submandibular gland which is present over here, and this submandibular gland is related to the lingual nerve. The lingual nerve is this nerve which is running like this over the superior aspect of this gland, and it is running forwards towards the oral cavity. Now this lingual nerve is giving attachment to the submandibular ganglion also, the submandibular ganglion via its roots, and these are going to the gland also. Now there is a nerve which is towards the inferior aspect. This is the hypoglossal nerve which is going towards the muscles of the tongue, and this nerve is also in relation to this submandibular gland. Now for the relation of the lingual nerve, we can see one more thing, that the lingual nerve, it is related to this submandibular duct. The submandibular duct which is present over here, the lingual nerve as it is coming anteriorly, it takes a turn around this submandibular duct and then it reaches towards the oral cavity. So whenever we are excising this gland, the submandibular gland, we have to take care that we do not injure the lingual nerve as well as the hypoglossal nerve. These are the structures which may be injured. Apart from this, just near the angle of jaw, in the face if we see, if this is the face and this is the parotid region, the facial nerve which is coming from the posterior side, it divides into 5 branches which are going to the respective regions. This is the first, second, third, fourth and the fifth. The first branch in this is the temporal branch. This is the facial nerve and these are the terminal branches. The second branch is zygomatic branch. Third is the buccal branch. The fourth is the marginal mandibular. And the fifth is the cervical. Now, if we see over here the marginal mandibular nerve, the marginal mandibular branch, it is actually running posterior and inferior to this angle of jaw and near the inferior margin of the mandible. So, over here it will be related to the submandibular gland which is present over here. The submandibular gland, the location is almost near the angle of the jaw. So, whenever we are doing the excision of the submandibular gland, this is again is a nerve which can be injured. So, therefore, for this question, for this question number 71, the question number 71 we have the answer A, that is the inferior alveolar nerve. Inferior alveolar nerve is not injured during the submandibular gland excision, and this inferior alveolar nerve is actually passing through the mandibular foramen which is on the inner aspect of the mandible, and this inferior alveolar nerve, it will be supplying, it supplies the lower gum and the lower teeth. Question number 72, plica triangularis. The plica triangularis is a mucosal fold which is present in the anterior inferior part of the tonsil. The question number 72. In this we talk about the tonsil and the answer for this question is A. Over here it is talking about the plica triangularis. If we see the tonsil, it is an almond shaped structure and towards the anterior inferior part, towards almost over here, it is covered by a mucosa which is termed as plica triangularis. Then towards the upper portion over here, almost over here, there is another fold which is termed as plica semilunaris. This fold, mucosal fold, is actually covering the upper portion of the tonsillar fossa. The tonsil, it is present towards the posterior aspect or towards the base of the tongue on either side of the tongue. If you see, this is the tongue. The tonsils are present on the either side, and these tonsils, these are present in the tonsillar sinus or the tonsillar fossa. They are being guarded by two folds, anterior fold or the posterior fold, termed as anterior pillar or the posterior pillar. Towards the anterior side, we have the palatoglossal fold. Anteriorly, we have the palatoglossal fold. And in this fold, the palatoglossus muscle is running. Towards the posterior side, this is the anterior side and this is the posterior side. Towards the posterior side, we have the palatopharyngeal fold. And this fold is consisting of the palatopharyngeus muscle. Then if we see, it is having the upper pole and the lower pole also. The upper pole is related to the soft palate and the lower pole is related to the tongue. Then it is having a medial and the lateral surfaces also. If we see the medial and the lateral side, the lateral view of the tonsils is in this manner. This is the medial aspect, the medial surface, and towards here is the lateral. The medial surface over here, it is opening, it is facing towards the oral cavity, and it is being covered by an epithelium. The epithelium is non-keratinized stratified squamous epithelium. Non-keratinized stratified squamous epithelium is there, and at this side we can see the tonsillar crypts are present. There are depressions which are known as tonsillar crypts, and in this the one which is the largest is known as intratonsillar cleft. Towards the lateral aspect, over here the lateral aspect is being covered by a capsule. We use the term hemicapsule because it is covering the half, only this much portion. And this hemicapsule is being derived from the pharyngobasilar fascia. Over here, this is the tonsillar bed towards the lateral aspect, and it is mainly formed by the superior constrictor muscle. So for the question number 72, answer is A. Now we come to the question number 73. The question number 73, in this we have to identify these structures in the coronal section of the brain. Now we will just identify the various structures which are present over here. First of all, we will identify the A structure. The A over here, this is the frontal cortex. The arrow is on the frontal cortex. The B structure over here, this is a triangular nucleus which is present over here, and this triangular nucleus is a lentiform nucleus which is a part of basal ganglion. Then the C is the insula. The D arrow is towards a nucleus which is present over here towards the medial side, a oval shaped nucleus, and this is the thalamus. In the question number 73, they have asked that identify the insula. So insula is at the C. So the answer for this question is C. Now if we try to identify the rest of the structures which are present over here, we can also visualize the caudate nucleus. This is the location of caudate nucleus. The caudate nucleus. Then this section which is over here, the triangular section, this is the triangular section of the lateral ventricle. In between the thalamus, there is a midline slit which is seen over here. This is the third ventricle. The fibers which are present over here, these are the fibers of corpus callosum. Then this membrane which is present is the septum pellucidum. Now if you see the lower portion of the septum pellucidum is present like this. The membrane is septum pellucidum, and in the lowermost part of the septum pellucidum, this structure is termed as fornix. This is the fornix, the lowermost part of the septum pellucidum. So these are the various structures which can be seen in the coronal section of the brain over here. Now next question, the question number 74. The question number 74, it is talking about the transverse pericardial sinus. For the transverse pericardial sinus, this transverse pericardial sinus is present towards the superior aspect of the heart. The transverse pericardial sinus, if you see this picture over here, we can see that the finger is actually passing through the transverse pericardial sinus. This finger, anterior to this finger, the structures which are lying are the ascending aorta and the pulmonary trunk, and posterior to it lies the superior vena cava. So this transverse pericardial sinus, it is a space between the arterial end is present towards the anterior side, including the ascending aorta and the pulmonary trunk, and posteriorly we have the venous end. The venous end, it includes the superior vena cava. This picture over here, it is showing the superior view of this transverse pericardial sinus. The transverse pericardial sinus, it is present over here. This is the arrow over here, and on either side of the transverse pericardial sinus, it is communicating with the pericardial cavity. So for the this pericardial sinus transverse, towards the anterior side, we have the arterial end, which includes the ascending aorta and the pulmonary trunk. Then towards the posterior side, the venous end is there, which includes the superior vena cava. Inferior to this sinus, the left atrium is there. So the answer for this question is C. The question is, it is asking posterior to this sinus, which structure is present? Posterior to this, superior vena cava is there. Now the question number 75. The question number 75, it is talking about the splenic artery. First of all, we will discuss regarding the splenic artery. The splenic artery, as we know, it is one of the largest branch of the celiac trunk. The celiac trunk, it arises as an anterior branch of the abdominal aorta, and it arises at the junction of T12 and L1. Then further it gives three branches. First is the left gastric. It gives the left gastric artery, then the splenic artery. The splenic artery is the one, this is the largest branch, and after that it gives common hepatic artery. In this, the splenic artery is the one which now will run towards the spleen side, and when it is running towards the spleen, the first thing is that it is having a tortuous course. If you visualize over here, this is the splenic artery and this is having a tortuous course when it is going towards the spleen. And while it is going towards the spleen, it is giving branches to the stomach as well as it is giving branches to the pancreas. For the stomach, towards the fundus, it is giving branches, and these are the short gastric branches. Then towards the greater curvature, it gives a branch which runs along the greater curvature of the stomach. It is the left gastroepiploic artery. So these branches which are towards the fundus of stomach, these are short gastric artery. And this one over here, which is running along the greater curvature, this is the left gastroepiploic. The left gastroepiploic artery. This left gastroepiploic artery, it anastomoses with the right gastroepiploic artery at the greater curvature of stomach. The right gastroepiploic artery, it arises from the gastroduodenal artery. So these are the branches which are given to the stomach. Apart from this, it is also giving smaller branches which will supply the pancreas, and these are the pancreatic branches. In this, there is the longest branch which is termed as pancreatica magna, the arteria pancreatica magna. So these branches, these are termed as pancreatic branches. These are the pancreatic branches. And in this, the longest branch is termed as arteria pancreatica magna. So therefore it is supplying the pancreas, and specifically it is supplying the body and the tail of pancreas. These branches are for the body and tail of pancreas. Then it is giving supply to the fundus and the greater curvature. This is for the fundus, and the gastroepiploic, they are towards the greater curvature. Now after this, After supplying these structures, it will be reaching the spleen, and in the spleen it will be giving non-anastomosing branches. The branches, they do not anastomose with each other. So as it reaches the spleen, in the spleen, the splenic artery, it divides into branches which are the straight branches, and they are termed as penicilli. Later on, they will form the ellipsoid, which will form the arterial capillaries later on. So these branches which are given within the spleen, these are the non-anastomosing branches. And if we see the question, the answer for this question is C for the 75. For the 75 question, we have to choose incorrect statement. In this, A is correct, that it is having a tortuous course and it is a branch of celiac trunk, so B is also correct. C is wrong because it is not anastomosed freely within the spleen, it is having non-anastomotic branches. D, it is correct that it supplies a greater curvature of the stomach. Now the next question is regarding the penis. In this we have to choose the incorrect statement. For the question number 76, the answer is C. If we see the structure, the penis is having root, and the main part is termed as body. The root is having two crusts. The two crusts is there and one bulb is there. The bulb is formed by the bulbospongiosus muscle. Towards the body side, we are having erectile tissue. We have the corpus cavernosum, which are 2 in number. Then the corpora spongiosum, the corpus spongiosum, which is single in number and it is present in the midline. Now the crus is the one, the root, in the root, the crus is the one which continues as the corpus cavernosum. So the two crus, right and left crus, they are continuing into these corpus cavernosum. And when we talk about the bulb it continues as the corpus spongiosum. And this corpus spongiosum, it later on continues into an expanded portion known as glans penis. Now within the corpus spongiosum, the urethra is present over here. The penile urethra is present within it. For the urethra, we are having anterior parts and the posterior parts. The anterior parts, the penile urethra, is present in the corpus spongiosum, and the rest of the parts are pre-prostatic, prostatic, and the membranous parts, which are included as the posterior urethra. So now if we come back to the question, in this, A option is correct, that corpus spongiosum, it expands terminally to form the glans, as well as the B option is also correct. The arterial supply to this structure, it is by the internal pudendal artery. And also the D option is also correct, that the penile urethra runs in corpus spongiosum. Now for the C option, the skin of the root of the penis is actually supplied by superficial external pudendal artery. So therefore, if we go for the best answer will be C, because it is supplying the skin around the root. So the answer for question number 76 is C. Then we come to the question 77. In which zone of the prostate gland is prone to BPH? for this question, the question number 77, the prostate gland, the answer is B, that is in the transitional zone. The transitional zone is the one which is prone to BPH. Now for this we should know the McNeil's classification. According to McNeil's, it classifies the whole of the prostate into three portions. First of all, the peripheral part, then the central part, and the transitional part. The transitional part is periurethral. The peripheral part is the one which is consisting of the 75% of the glandular tissue. 75 to 80% of the glandular tissue. %25% is by the central part and the 5% is formed by the transitional part. If we visualize that how these portions are present over here, if this is the urinary bladder with the urethra and this is the ejaculatory duct, this is the urethra and this is the ejaculatory duct. Now the portion of the prostate which is present adjacent to the urethra over here is the transitional zone. Or the periurethral zone. Then the portion of the prostate which is present towards the posterior side, this is the peripheral part or the peripheral zone. It is present posteriorly. Then the portion which is present between the urethra and the ejaculatory duct, this small portion, this is the central part. Anterior to this we are having the anterior fibromuscular stroma. So now in this if we see the three portions, one is the peripheral part, this is present on the posterior side, then central, it is present between the urethra and the ejaculatory duct, and the one which is present along the urethra, periurethral, is a transitional zone. Now among this, the one which is prone to the benign prostatic hypertrophy is a transitional part, it is prone to BPH, and the peripheral part is the one which is prone to prostatic cancer. So the answer for the question number 77 is B. And the question number 78, it is talking about the sacrum, that in the males the articular surface it extends for how many vertebrae? The answer for this is C. It is extending till either 3 or 3.5 vertebrae. The question number 78. When we talk about the sacrum, the articular surface or the auricular surface, in the males it is extending till the 3 to 3.5 vertebra, and in the females it is extending only till 2 or 2.5 vertebra. So this is the difference between the male and the female sacrum. Apart from this, if we see in the male sacrum, as compared to the male sacrum is long and narrow. It is long and narrow, and if we compare the sacral index The sacral index in the males is 105 and in the females it is 115. The sacral index, it is actually comparing the length and the breadth. For the sacral index, we measure the breadth at the base of the sacrum divided by the length. The length is starting from the promontory till the apex of the sacrum multiplied by 100. So in this way we calculate the sacral index. The rest of the differences for the sacrum, the lumbosacral angle, or we say the eminence due to this lumbosacral angle, it is more prominent in females. It is more prominent in females. Apart from this, the pelvic surface of the sacrum, the pelvic surface of the sacrum, it is pointing more towards the lower direction or towards the downward direction in the case of female. It is directed downwards in females. So these are the differences between the male and the female sacrum, with the help of which we can differentiate the male and the female sacrum. And regarding the articular surface, for the articular surface over here, in the males it is extending to 3 and 3.5 vertebra. So the answer for the question number 78 is C. Answer is C. The next question, 79 question, it says that pudendal nerve block, it abolishes pain from. It will abolish the pain from the inferior part of the vagina. The question number 79, the answer is D. It abolishes the pain from the inferior part of the vagina. The pudendal nerve, it is derived from S2, S3 and S4, and this is the nerve which is actually supplying the structures of the perineum. It is supplying the structures of the perineum, which will include the skin, the muscles of perineum, as well as this lowermost opening of the vagina. So it is supplying all these structures of the perineum. The various branches which are given by this, it gives off inferior rectal nerve, then it gives a perineal branch. Now this perineal branch is the one which is actually supplying the lower part of the vagina, and apart from that, the dorsal artery of the penis or the clitoris. These are the branches of the dorsal nerve of the dorsal nerve. So all these are the branches of the pudendal nerve, and they are supplying all these structures of the perineum. And in the perineum they also supply the external genitalia. So by this we come to know that the lower portion of the vagina is being supplied by pudendal nerve. So if we do the pudendal nerve block, in that case that portion of the vagina will be involved. Now the pelvic viscera which is present, the pelvic viscera, the whole of the pelvic viscera, including the cervix as well as the upper part of vagina, it is supplied by the autonomic nervous system. It will be supplied by autonomic nervous system. The sympathetic supply is there by the lumbar nerves and the lumbar splanchnic nerves, and the sympathetic supply is by the nervus vagantis. They will be supplying the cervix as well as the upper vagina. So therefore, the answer for this question, the question number 79 will be D, because it supplies the pudendal nerve block is there. It will abolish pain in the inferior part of the vagina. For the next question, the question number 80, we have to identify the cells in the slide which will secrete the hydrochloric acid. So first of all, we will see the slide. For the slide, we come over here. This is a slide of the stomach, and this slide is actually showing the gastric gland. And the various cells which are present in the gastric gland over here, the main cells are the oxyntic cells, also termed as parietal cells. Apart from this, we have chief cells and the mucous cells are there. The oxyntic cells or the parietal cells, they are present in the upper portion of the gastric gland. They are present in the upper portions of the gastric gland, and if we see the appearance of these cells, they are oval or polyhedral shaped cells which are large cells, and in the center they are having the round nucleus like this. The cytoplasm which is present is a clear cytoplasm, and it gives a beaded appearance, or we say the fried egg appearance is there. So it is a typical cell which is present over here, and this has been mentioned in A over here. The cell which is marked as A over here, these are the specific oxyntic or the parietal cells. These are the cells which will release hydrochloric acid, as well as it releases the intrinsic factor. Then the chief cells, they are smaller and they are more basophilic. They are actually present towards the lower portion of the gastric gland. And these chief cells, they release the pepsin. They help in the formation of this pepsin enzyme. Over here, if you see, the D over here is the chief cell. A is the oxyntic and D is the chief cells. B and C over here, they are being put, the arrows have been put on the mucous cells. The C is the surface mucous cell, and the B over here is the mucous next cell. This mucous next cell, these are actually cells which are filled with the mucus, and when we see the cells, they are lightly stained with the nucleus towards the periphery. The nucleus will be pushed towards the periphery and the nucleus is flattened. They are more present towards the gastric pit. They are more present towards the gastric pit area. So therefore, if you see the question number 80, the answer for the question number 80 is A, because the question is asking that which cells they secrete the hydrochloric acid, and the hydrochloric acid is being secreted by the oxyntic cells or the parietal cells, which is the A option. So the answer for the question number 80 is A. That completes till the question number 80. So thank you.